In this video, Professor Thomas Seyfried explains how to do metabolic therapy. And stick around for some valuable information from me about this whole thing.
I'm not a physician, so I can't treat anybody, but I can certainly guide physicians in treating their patients. What we do is we get the patient into a state of nutritional ketosis, first off, make sure they get healthy. A lot of cancer patients, they have obesity, type 2 diabetes, they have hypertension, high blood pressure, sometimes parasitic infections. You can't believe how unhealthy some people are. Okay, step one, get cleaned up. And by water-only fasting, zero carbohydrate diets, we slowly bring the body back into a new state of metabolic homeostasis. And then at Boston College here, we developed the glucose ketone index calculator, which is a ratio of blood glucose to blood ketones in the blood, circulating level of glucose to ketone. What we have found, and this is diet irrelevant, what we have found, if a cancer patient can get the ratio down to 2.0 or below, preferably below, the tumor cells start to get hammered, because now you're putting them under incredible metabolic stress. And that will really downregulate the ability of the tumor cell to survive. But they can hang on, because they're using some of that glutamine. So you come in with the pulse, and the pulsing now, you use glutamine targeting drugs while the patient is in nutritional ketosis under low glucose conditions. And gradually you start to tear down and break down the tumor. And as I said, also the diabetes goes away. High blood pressure goes away. Obesity goes away. All these things go away along with the cancer. So, and that's only because you're bringing your entire back to the body the way it should have been in the first place. And it's very hard to get cancer if your mitochondria remain healthy. We have seen this over and over again. So we're just essentially reconfiguring what metabolic health is, and we use small doses of drugs to target the glutamine. And we can use IV vitamin C. Once you're in nutritional ketosis, even conventional chemotherapies and radiation therapy will work. You can use much lower doses of chemo and still get a tremendous therapeutic benefit when the body is in therapeutic ketosis. So this is the future. And again, you have to restrict the two fermentable fuels with diet and drug and transition the body over to ketosis, because the tumor cells can't burn ketone bodies, but the brain, heart, and all your other cells, muscles, can all burn fatty acids and ketones, except liver. Liver burns fatty acids. So this is the solution to the cancer problem. But you're right. It's a monster paradigm change. Physicians must be re-educated. The National Institutes of Health have to acknowledge this, because we continue to poison and irradiate hundreds and thousands of people because the promise of the genetic theory failed. We were hoping that because cancer would be a genetic disease, we would use precision in medicine and all this, then we wouldn't have to use radiation and chemo. Okay, we still use radiation and chemo because the promise of the somatic mutation theory never came, never will come. Do we understand that?
The promise of the genetic theory failed. Now, I'm not a doctor. None of this is medical advice. I'm just some random bloke on the internet. This may be the ramblings of a madman. But if it was me and I was going through standard of care at the moment, I would certainly be in therapeutic ketosis. It's the mainstay of any treatment. Anyway, that'll do it for today. Please like the video if you did, and don't forget to subscribe. You can join our community at metcancer.com/forum. Now do yourself a favour and go and watch this video.